Let's bring in the National Co-ordinator, Presidential Task Force on COVID-19 to tell us more about key plans to stem the spread of the virus in Nigeria. Dr. Sani Aliyu, thank you for joining us tonight on TVC News at 10.
Good evening.
The presidential lockdown order on Lagos, Abuja and Ogun states will clock 2 weeks on Monday. Of course, you know that Ogun State had to delay for some days. But what is the task force evaluation of compliance to the order 10 days after?
So we are still in the process of collecting data that will take a decision in terms of the recommendations that might come forward. But so far, we're actually pleased with the general level of compliance. We know there have been areas, especially the outskirts of Abuja, for instance, and a few spots in Lagos, where people have not entirely complied with the stay-at-home order. But generally speaking, the public have been very cooperative. They've been very understanding. They realize the importance of trying to stop this pandemic from spreading any further. We will be meeting over the next few days, the Presidential Task Force, and we will then make our recommendations to the relevant authorities, after which a decision will be taken.
Okay.
on
So as of 30th of March, the Nigeria Center for Disease Control said we were tracking 6,000 suspected cases and that the lockdown would help fast track the process. How many have we been able to trace thus far?
So I don't have an exact percentage because I haven't looked at the data in the last few days, but certainly we have tracked the majority. I would say we've tracked more than 70% so far and been fairly successful in that regard. Generally speaking, most of the positive cases that we continue to have are linked to either people who have traveled abroad or those that were positive in this country. But community transmission appears to be coming up now, especially in Lagos, and this is something that we're very keen to nip in the bud. The main reason why we actually went for the lockdown is to enable us slow down the number of new cases that are coming up, and at the same time give us leeway to actually chase those contacts that need to be traced. Okay. And into isolation. And so far, I must say, it has worked to a fair extent. It has worked, but there's still a lot of work that needs to be done. If you recall, the incubation period for the virus itself, for the disease, is maybe up to 2 weeks, up to 14 days. So okay. Some of the new cases now seeing now may actually be people that were infected even just around or before the lockdown.
Dr. Aliyu, 70% is good, if indeed we have traced that much. But there's the perception that we have only tested very few people, and that is what is keeping our numbers artificially low. Is there any particular reason we have not yet adopted the model of tracing, testing, and treating, other than asking suspected cases to first self-isolate, wait for symptoms before getting tested?
So it's this is not just in Nigeria. As far as I'm concerned, even the WHO regulations are pretty clear. There are clear indications for testing. There are clear indications for testing. You don't do mass testing in situations where people do not have symptoms. Neither do you do testing on the basis of just contact alone. The reason being that this is a PCR test. What you're doing is you're trying to detect the presence of the virus in the upper respiratory tract. Initially, when you come into contact with the virus, you need an incubation period during which the virus replicates deep within the respiratory tract before it becomes excreted and it's brought up. So during that period, you'll be asymptomatic. You will not have any symptoms. And respiratory viruses have evolved over time to induce respiratory symptoms such as cough, sneezing, or a runny nose in order to escape. Okay. And that's the best time to test. Okay? That's the best time to test. And that's why we always insist that people need to have some form of symptoms. It doesn't matter how mild, because our threshold for testing should be very low. But symptoms like fever, or like a cough, or shortness of breath, or generally feeling unwell, and we will test. But the right thing is to follow those symptoms, isolate yourself, follow the symptoms, be monitored very closely. Almost 90% of cases will have a fever at some point.
But are you aware that there are organizations already calling for instance, the Red Cross today called for suggested universal testing as symptoms do not manifest early, and that is one of the advice coming to a country like Nigeria. Does this in any way has anything to do with our testing capacity?
No, our testing capacity has been increasing progressively over the last few weeks. As you said, we've now opened, we started off with about 5 labs at the beginning of the pandemic, and we now have at least 9 labs operating, and a few are coming on stream in Kano and Kaduna. Kano, they've just finished the assessment, and I think they're on Kaduna at the moment, then followed by other states in the north. It's true that the number of tests we're doing is few, but we need to be cost effective as well. These tests are extremely expensive. You need to test in a situation where you are most likely to get a positive. And we follow the World Health Organization guidelines.
Okay.
Scientifically speaking, you do not test without symptoms, partly because your pre-test probability, that's the likelihood of getting a positive test, is very low. And if you have a negative test in that situation, if you're in an incubation period, that test has no value at all in terms of predicting whether or not you're going to develop.
I get your point.
So in a way,
very quickly, let's talk about figures now. A couple of weeks ago, the NCDC said we had 5,000 test kits rather. There were 20,000 others donated that were being verified at that time. What is the number of testing kits right now, bearing in mind that we have just received some from China? Dr. Ali, are you there? Well, we might have to get back to the national coordinator of the Presidential Task Force on COVID-19, who has been talking to us about updates on the ongoing presidential order on lockdown. He indeed made mention that they are pleased with compliance. He also said that over 70% of those contact tracing has been done across the nation within this period. I'm told that Dr. Aliyu is back now. Very quickly, let us talk about what is expected now. We are told earlier that we would have to wait on Mr. President to decide on whether or not the period of the lockdown will be extended. But just a few minutes ago, as you are aware, the NCDC announced 14 new cases, 13 in Lagos, 1 in Delta, bringing the total figure to 288. From a professional perspective, what does that portend for the possibility of having the lockdown extended?
So I'm afraid I can't preempt any decision that will be taken in the coming days. As I said, we will be meeting over the public holiday period, and we'll make the necessary recommendations. Having said that, yes, the numbers still remain relatively high, but it's still not, we're not seeing the doubling that you see in other countries every 3 to 4 days, where the number of new infections doubles. So in a way, that's a fairly positive sign that we are getting on top of the epidemic. But it's probably still too early days to see the impact of a lockdown. In China, for instance, it took a much longer for what we call the RO, which is the number of people getting infected with a single case. The RO needs to be less than 1 in order for the epidemic to start waning, and it took a lot longer than 2 weeks for that to happen. The same way with UK as well. You can see that they've been under lockdown for a lot longer than we have, and it's only now that the numbers are starting to turn. Nevertheless, there are other interventions that we will continue to advise on, things like social distancing and avoiding mass gatherings, especially at this time as we approach Easter. People need to realize that this pandemic is far from over, and people really need to take care and protect themselves and protect their loved ones.
Dr. Sani Aliyu is the National Coordinator of the Presidential Task Force on COVID-19. We appreciate the job your team is doing, and we look forward to better days ahead. Thank you for talking to us tonight. Coming up.
It all started with a private party, which video went viral and said to be posted by Abdul Rashid Bello in Lekki.